A frequent question I get is, how did I start down the path of holistic dentistry? To answer that, we have to walk through a couple of years and a lot of time in a journey with my wife. A lot of this has to do with health problems that she had, and we spent years working to find solutions and answers to. In the end, we ended up getting to the end of that road and having no resolution whatsoever. Basically head scratching and being told that we can do some exploratory surgeries and maybe we'll have some success and maybe we won't. We have absolutely no idea. At which point she was introduced to a functional doctor and started down the path of functional medicine, it was not an instantaneous change, but it was a progressive change to a much better circumstance. And that continued for almost 2 years when an injury to her back put her in extreme pain and complete loss of function. And again, trying to figure out how to regain function and get out of pain. And at that point, we talked to both a traditional orthopedic surgeon who gave her the talk that we're going to do surgery. It's going to last you somewhere between 3 years and 10 years, and then it'll have to be redone. And every time we redo it, it's going to be worse and it's not going to last as long. And she was sitting there at early 40s doing the math on this, saying, at best, I'm going to be early 50s and we're going to get 1, 2, maybe 3 surgeries, and then I'll have a full spinal fixation. That's not what I wanted in life as a grandma. And we ended up talking with a doctor who was doing some injections into the spinal spaces, into the bulged discs and facets with PRF and steroids, ozone, and stem cells. And we ended up going that route, and it was definitely not instantaneous, but it was perpetual improvement and getting better and better. And the great thing about it is it wasn't destructive. We weren't going in and doing a surgery that ground away bone or removed physical properties of her spine. And during that process, she came across some literature that was talking extensively about root canals and cavitations. And it was Dr. Thomas Levy's book on the hidden epidemic. And I was reading through that book, and he has so much research that he puts into his books. It was phenomenal. And as I was reading through the book, you come to a realization that either traditional dentistry is missing the boat, or this guy's totally and completely crazy. And the more I read, and the more I started reading the articles as well, the more I was convinced that traditional dentistry was missing the boat. And we ignore so much of the research that's out there and only accept research that supports the narrative that we want. And Thomas Levy is a cardiologist, and one of the key features of his book that he's talking about is that root canals in men cause heart attacks and in women cause breast cancer. And that is not something that if you have a factor that you can change, you want to take care of that immediately. You don't want that to be in in your body. And that was a major shift for me, is that we're not just treating disease, but we're wanting to focus on health optimization. How do we make our health better? Rather than wait for a disease to happen and then treat the disease, how can we move towards the most optimal health we can possibly get? And that was a mindset shift. And with that mindset shift, it changes how you view dentistry, because so much of dentistry has ramifications outside of the mouth. We talk about galvanization and toxins. So for toxins, mercury is a perfect example of that. In dental school, I was taught that once the mercury is fully annealed, that it is no longer able to come out of amalgam. However, that's not fully accurate. And there has been research that has been done over and over and over again. There have been direct correlations to the number of amalgam surfaces inside your mouth and the amount of mercury in your blood. That's kind of proof that amalgam does not hold on to the mercury, it's losing it. And if it's losing it, it's inside your body and you're ingesting it or absorbing it, depending on how you want to view that. So these are aspects that once we switch from the mindset of can the body tolerate it to is it the best thing we could do for the body, you get two wildly different answers. There are some people that can tolerate it, and there are a lot of people that cannot. And the simple answer is that it's not good for anybody. Even if you can tolerate it, it's always better not to have to see how much poison we can put in our body before we have toxic effects. So the concept of focusing on really optimizing health, and in my case, the window is the oral cavity, the mouth, the airway, that changed how I viewed every patient and how I viewed every treatment plan. That was the start of the journey for me for holistic dentistry and really the optimization of health.